Hi, everyone. I'm Julie McClure. I'm the founder and CEO of Hello Me, and super excited today to be kicking off our TMI Lounge Expert Series. And today we've got Dr. Maille Devlin, who is a licensed naturopathic doctor, and she specializes in women's health and stress management and healthy aging. So welcome, Maille.
Thank you so much. I'm so excited to be here and very excited about TMI Lounge in general. I think it's amazing. So super excited.
Today we are excited to chat with you about all the things we should have been talking about growing up, which is, understanding your menstrual cycle. And so I'm really excited to have you today to really shed some light in terms of how our cycles should be taking place, like what we should be expecting, the hormones that are involved, what's the average length, and just really kind of breaking it down for us so we can truly understand what our menstrual cycles should be doing and what we should be looking out for, if anything.
Awesome. Yeah, I think it's something that's super important. I always end up talking to patients a lot about, what is your menstrual cycle? How long is it? Because we all hear different things, and sometimes it's hard to tell, is there something wrong? Is this how it's supposed to be? And just because something happens a lot to maybe your whole friend group doesn't mean it should be happening from a health standpoint. So yeah, taking it really back to the basics, your menstrual cycle in general, it can range. So the whole length, when we say menstrual cycle, it means the whole cycle, which I'll get into the different phases of it, not just the bleeding portion. So that bleeding portion is the beginning of the cycle called menstruation or bleeding or the secretory phase. And that phase can be about 2 to 7 days. So that's where you're actually bleeding. And so that's kind of what we call day one in the cycle. And that whole cycle can be anywhere from 21 days to 35 days. That's all considered normal. Now, what also needs to be considered is your own normal. So if you always have a 23-day cycle and now you have 35-day cycles, that's no longer normal for you. So that's something to consider. So if we think of this cycle in kind of 4 separate parts to it, we have your menstruation, then we have the follicular phase. So the follicular phase actually starts at menstruation, goes over the whole thing. So follicular phase starts day 1, includes menstruation, and goes all the way to ovulation. Okay, so then in this time, there's a hormone called FSH, follicle stimulating hormone. It's released from our brains, and it does exactly that. It tells our follicles, which are way down in our ovaries, so we're going brain to ovary, and it says, okay, we need to start growing some follicles. Follicles end up being the eggs. So you've got high amounts of FSH. Then you start growing these little follicles that are in your ovaries. One special one ends up being kind of that egg for the month. Okay, so this one grows the most. Then that follicle itself starts to secrete estrogen. Estrogen peaks. So we're still in that 1 to about day 14 of the cycle. This is where estrogen is really high. This is where estrogen is highest on the cycle. Okay, we've got high estrogen. This high estrogen now causes that. So we've now got that follicle being released from the ovary into the fallopian tube. So if you think of the back of a picture, I'm sure you've seen of a uterus, fallopian tubes, ovaries. We've got ovaries. Now that egg is going into the fallopian tubes. That is your ovulation. So I'm sure everyone's heard of ovulation. That's kind of part 3 of this 4 parts. So we had menses. Now we've got follicular phase. We're growing that egg. We've now released that egg. That egg is now ovulated. Now what happens is that in order for that egg to be released, there's something called LH or luteinizing hormone. And so that surges during ovulation. So if anyone has ever tried to track their ovulation, you're trying to get pregnant and you pee on these little strips, that is the hormone that you're measuring. So we've got our FSH at the beginning of the cycle, then we've got a peak in estrogen, then we have LH. Now the very last one is progesterone. So now we're in this luteal phase. If you think luteinizing hormone, now we're in luteal phase. It's the second half of this cycle. This is when progesterone is highest. And so if we think of kind of progesterone is high, estrogen comes back up a little bit here, but doesn't get as high as it was before. And so that's the second half. Now, if we think back anatomically, what's happening, that egg has been released. These hormones are still being released from the ovary. If that egg is no longer fertilized, what happens is all of these hormones then drop. what's happening in the uterus during this time is that endometrial lining, or the lining of the uterus, is building up. Because of this high amount of progesterone we have, it causes that lining to build, because the uterus is now becoming a place where we want to be able to hold a fertilized egg. Now, if it's not fertilized, what happens? Hormones drop, and then we go all the way back to the beginning of the cycle, and you menstruate, or you shed that lining. Okay. So I know I mentioned a lot of hormones there, but just to summarize, you've got menses, which is part of the follicular phase, which is where the follicle is developing, then ovulation, and then you've got your luteal phase, and that's where your lining of your uterus is getting prepped. And if you do not fertilize that egg, you release that lining, and that's menstruation.
That was a great breakdown. And I think, so few of us actually break it down in such a concise manner so we truly understand what's happening during the month. I would love you.